I'm a neurologist specialized in stroke and neurocritical care. A neurologist is a physician who takes care of the brain, the spine, the peripheral nerves, all the way to the muscles. The stroke physician is the neurologist that takes care of patients who have strokes, which is the leading cause of disability and in the United States. And the critical care physician is the one who takes care of patients with neurological conditions that are very, very, very sick. What inspired my career in medicine was tradition. My grandfather was a physician, he was an ophthalmologist. I never met him, but I remember when I was little playing in his office with his tools, and I thought always that I was going to be a physician, and here I am. And I was lucky enough to encounter mentors that were shifting the way neurology was practiced, from the watching and pointing to the actual doers. And I got engaged into that new era of neurology. I've been lucky to practice now for almost 30 years in this field. What I found most rewarding in my practice, I think, is teamwork. None of us work in isolation. I think we all work as a team, not only neurologists with neurologists, but neurologists with other specialties. And every day I come to work, I encounter wonderful, extraordinary physicians that are part of that team, and I'm honored to be part of their team as well. And as far as the approach to what's my particular approach to patient care, my uniqueness, I think that my uniqueness to patient care comes from the fact that I encounter truly every patient as somebody that I think I know, that is a friend or family. And so I try to put myself into their feet. And something is very difficult because I never felt, the lack of movement of one arm, or never suffered a stroke. But I think that's what makes me different, if anything, is that I truly consider every patient as somebody that I know and as a friend or family.